For decades, we've heard this one story about healthcare in Africa, that it's all about scarcity. But what if that's not the whole picture? What if the doctors were actually there all along, and we've just been looking at the problem completely the wrong way? And this right here, this is the paradox we're diving into. Think about it. Africa trains doctors, Africa trains nurses, but millions of patients still can't actually get to them. It's like there's this huge gap between the care that exists and the people who desperately need it. So, what's really going on here? All right, so let's get into it. This is what we're calling Africa's healthcare paradox. And the main idea, the big takeaway, is this: it's not a shortage story, it's a connection story. So you've got these two competing stories, right? On one hand, the common story we always hear is there aren't enough professionals. But the real story, the one we need to focus on, is that there's a massive gap in connection. It's not about the people, it's about the system that's supposed to bring them all together, and it's just not there. Okay, and check this out. This really puts the scale of the challenge into perspective. According to the World Health Organization, Africa carries a quarter of the entire world's disease burden, a full 25%. But it only has 3% of the world's healthcare workers to fight it. That's a wild mismatch. And here's what that actually looks like for people on the ground. The average across the continent is just 1.55 health workers for every 1,000 people. Now, to give you some context, the WHO says you need at least 4.45 to provide just the essential services. You can literally see the gap right there. And sure, training more doctors is great, but that alone isn't going to close the gap that wide. So this leads us to this really interesting idea from McKinsey and Company. They call it the health workforce paradox, and it's exactly what it sounds like. The healthcare professionals are there. The problem is the system, the infrastructure, just isn't set up to get them where they need to go and keep them there. And that creates this huge structural gap. It's like the missing piece of the whole puzzle. Okay, so let's move from the stats to the stories. What does this connection gap actually feel like for a real person? Because this is where it gets incredibly personal. This is the human cost. Just imagine this for a second. You wake up at 5 in the morning, you got a fever, your chest is tight, the clinic nearby, it doesn't even open for another 3 hours, and the closest doctor is a 4-hour journey away. This isn't some crazy hypothetical. For millions of people, this is just a regular day. The distance itself becomes part of the problem. And what happens if you need to see a specialist? Well, this is where that gap becomes a full-blown crisis. Let's say you've got a condition that needs attention within, say, 8 days, but the earliest appointment you can get is 8 months from now. That wait, that can literally be the difference between life and death. And even if you do see a doctor, it's not over. The follow-up care, which is so crucial, often just falls apart. Why? Well, it's the simple, brutal realities of life. It's the cost of a taxi fare versus buying food for your family. It's losing a day's wages because you have to wait in a long queue. And the result? People end up back in the hospital for things that were totally preventable, and chronic diseases just go untreated. So if the problem is a broken connection, then the solution has to be about building that missing road, right? Let's take a look at how a company called AfriFarm Health is tackling this head-on. Here they are. Now, AfriFarm Health's whole model isn't about building more shiny hospitals. Instead, they're focused on creating the digital infrastructure, the digital roads, to make the entire existing system work a whole lot smarter. And they start with this one simple but totally revolutionary idea: the patient does not travel. Instead, the care travels. All of it, the expertise, the diagnosis, the medicine, it all comes directly to the patient right where they are. So how do they do that? How do you make care travel? Well, they've built these 5 interconnected networks. It all starts with the virtual care network, for online consultations. Then, from that single point, a doctor can instantly send a prescription to the pharmacy partner network, or maybe refer you to a hospital partner for in-person treatment. They can even send a caregiver from the home care network to your house, or call in the emergency partner network. The key is they all talk to each other, creating this seamless journey for the patient. Okay, that all sounds amazing in theory, but what does it actually look like in the real world? Let's talk about the real impact, the new reality this connected care creates. And listen, these aren't just ideas for the future. This is happening right now. A mother in a rural part of Zambia is talking to a doctor on her phone. A worker in Lagos is managing his hypertension without having to miss a single day of work. An elderly diabetic patient in Ghana is getting visits at home. A kid in Nairobi is getting to an emergency room faster. This is what happens when you finally build that connection. And just look at this number. This is incredible. Remember that 8-month wait to see a specialist we talked about? With this connected system, that can get down to just 8 hours. Think about that. From 8 months to 8 hours. The impact is just massive, and it's immediate. All right, so as we wrap this up, let's bring it all back to that central idea. This isn't about throwing out the old system. It's about adding that one critical layer that's been missing all along. This quote just says it all, doesn't it? For so long, we've been told Africa's healthcare story is a shortage story. But it's so much more accurate to say it's a connection story. And that really is the heart of it. The doctors, the nurses, the pharmacists, they were always there. The skill was there. The missing piece was the infrastructure, the road that connects them all together. Which leaves us with this one big question to chew on. After all this time focusing on the symptoms, what really happens when you finally build that road, when you fix the root cause? And that's the powerful idea I want to leave you with. The doctor was always there. The problem was the journey. And now, finally, the road exists.